So hello everyone, welcome back to my channel. And last week we did white soluble vitamin K. So this week we will do the last one, which is vitamin E. Now fat soluble vitamins, as we all know, they're actually stored in the liver, so therefore it should be taken in a certain RD amount. Now what is vitamin E? Vitamin E is a fat soluble vitamin and it is a very important vitamin for your skin, your reproduction, vision, your blood and your brain as well. Now vitamin D also has antioxidant properties. What are antioxidants? Antioxidants are substances that protect your cells from the effects of free radicals. Now what are free radicals? Free radicals are actually, they're substances which are produced when food is broken down by smoke, tobacco smoke or radiation, and that's how free radicals are created. Now free radicals might play a key role in heart disease, cancer and other diseases as well. If you're taking vitamin E for antioxidant properties, you have to keep in mind that the supplements will not offer you the same amount as natural antioxidants in food. Now, foods rich in vitamin E include canola oil, olive oil, margarine, almonds, and peanuts. You can also get vitamin E from meat, dairy, leafy greens, and fortified cereals. Vitamin E is also available in oral supplements such as capsules or drops. Vitamin E deficiency can cause nerve pain called neuropathy. The RDA, which is the recommended daily amount for vitamin E for an adult, is around 15 milligrams a day. Now, it's different for different people. Like for infants, it's like 4 milligrams per day. For a small toddler or a child, it's like about 6 or 7 milligrams a day. For a child, it's about 11. And again, like I said, for the adults, it's about 15 milligrams a day. So that's all you need. You don't need excess. So you have to get your vitamin E tested first, your levels of vitamin E in your blood. And if it is normal or if it is not deficient, then you don't need to take any supplements. Now, the supplements are also used in different forms. Like for skin and hair, it's very popular. A lot of people have posted videos where they show that the vitamin E capsules are made into masks, like they are put into olive oil or coconut oil. They can be added as a hair mask or a skin mask, which is perfectly fine. But if you are taking it like an oral intake, then you should be careful with the amount you take. Vitamin E is basically used in certain research purposes. So for instance, the Alzheimer's disease. Now, high dose vitamin E, if taken, can actually delay the progress of Alzheimer's disease in some patients. Now, it is not actually a well-known fact that it can delay Alzheimer's, but it can, it's not necessary that a mild cognitive impairment might not lead to Alzheimer's, but it is a probability that if you give high dose vitamin E to such patients, they might not develop into a full-fledged moderate to severe Alzheimer's disease. Now, this vitamin E is also used in liver diseases. It has been shown, now this is research, alright? It has been shown that vitamin E supplements taken for like a long time, like a year or two, can improve the symptoms of non-alcoholic fatty liver disease. But since it is taken for a prolonged period of time, like let's say about 2 years, it can cause insulin resistance. So it might lead to diabetes, Preeclampsia. Preeclampsia is a condition basically which happens to pregnant women, and it is a very severe emergency. It raises the blood pressure in pregnant women. So for that, it says that vitamin E taken in excess can actually prevent preeclampsia. For men who take vitamin E supplements, vitamin E taken in excess, supplements can actually increase your risk of prostate cancer. So you have to be very careful with that. Now, vitamin D, if taken in appropriate doses, is considered quite safe. But if it is taken in excess, or sometimes it can lead to certain symptoms like nausea, vomiting, diarrhea, intestinal cramps, blurred vision, headaches, rash, gonadal dysfunction, and increased amount of creatinine in the urine, which is basically called proteinuria. So you have to be careful with the amount of dose you take every day. Know the RDA, know your supplements, and it's better to take antioxidants in your diet if you're not deficient, because that is a safer way of taking it. If a pregnant woman is considered and she's taking vitamin E, it's generally safe, but do talk to your doctor about the safety and precautions of vitamin E, because it can lead to certain issues. And of course, any vitamin taken in excess can also increase your chances of heart disease and stroke. So basically, talk to your doctor before taking vitamin E if, number one, if you have vitamin K deficiency. Number two, if you have some retina, if your retina is damaged, for instance, certain diseases like retinitis pigmentosa, if you have a certain bleeding disorder, And if you have neck or head cancer, also if you have diabetes, a previous history of a heart attack or stroke, or any kind of liver disease. Now, you have to stop taking vitamin E in certain cases, like for instance 2 weeks before surgery, especially if you have like a blocked arteries issue, like angioplasty is being done. You need to stop taking vitamin E because it can cause severe bleeding. Now, certain drugs can interact with the high doses of vitamin E, so they should be noted. Number one is the alkylating agents and the anti-tumor antibiotics. Now, what it does is the high doses of vitamin E can actually, slow down the process of these chemotherapy drugs, and that is really bad for you because if you're taking them to, decrease the progression of cancer. Now, number two is your antiplatelets and anticoagulants, which can actually reduce the blood clotting and therefore increase the risk of bleeding. Now, cytochrome P450 substrates, basically they interact with vitamin E in a negative way. So be very careful if you're taking omeprazole, which is basically an antacid. It's also known as Ryzac. You're taking it for your acidity issues. You need to be very careful with that. Again, vitamin E taken with niacin and statins. Now, statins are used to reduce the blood cholesterol levels. What it does is basically it reduces the niacin effect. And it's the same with the other drug as well. If you take it with vitamin K, it reduces the effect of vitamin K. Now, if vitamin K is deficient, it can cause severe bleeding because vitamin K is a natural anticoagulant. Now, since we were talking about vitamin E excess and drug interactions, we can also talk about vitamin E deficiency. Now, what happens if you are vitamin E deficient? It can cause spinocerebellar ataxia. It can cause certain myopathies like skeletal myopathy. It can cause, peripheral neuropathy, retinopathy, and impaired immune system, as well as red blood cell destruction. Now, vitamin E are used on the skin because it is a part of many creams and lotions and sunscreens. It can soothe like irritation from pollution and sun damage. It can also decrease the sebum oxidation, so it prevents blackheads from forming on your skin. It causes a long-lasting hydration for your skin, so up to 16 hours of hydration. And if used with like a sunscreen lotion, it can provide 4 times more, protection from sun damage compared to vitamin C. Now, what are the health benefits of vitamin E? Now, vitamin E, it basically fights, it's very important for your immune system because it prevents illness from happening and boosts your immune system as well. Number two, it is actually cardioprotective in certain amounts. It does prevent you from heart attack and stroke. But if you take it in excess, and if someone is suffering from a heart issue, then it can be quite problematic. It also decreases or reduces the effects of osteoarthritis in elderly patients, and it reduces the signs and symptoms of aging like wrinkles on your skin. And vitamin E also regulates gene expression, and it also is very important for smokers because in smokers it reduces the risk of lung cancer as well. It reduces the risk of cognitive impairment in Alzheimer's, like we discussed before. Now, the sources of vitamin E, which we have discussed before, but we will again talk about it. Now, avocado is a very rich source of vitamin E. It has about 12.5 mg. Then we have mangoes, papaya, olives, we have the sesame seeds, we have trout, and we have shrimps. Then we also have like kale, and we have red peppers. They have a lot of high amount of this vitamin E as well. Then we have hazelnut and almonds. We also have spinach, parsley, broccoli, turnip green, and these are the ones, kiwi. They also have high doses of vitamin E. So the main effects of vitamin E include prolonging the life of red blood cells, and therefore playing a very important role in cellular respiration, as well as being a part of the biological membranes in your cardiovascular system, in your nerves and muscles. So it provides a barrier and protective sheath. and therefore it is very important for your cardiovascular health, your nerve health, and your muscles. So you know, if vitamin E is deficient, it can actually cause a lot of myopathies and you know the neuropathies. So it is, now the good thing is it is so widely available in your diet. So it's very easy to, you know, even if you're a vegetarian, you can still have spinach, broccoli, asparagus, you know, green turnips and parsley, and parsley is widely used in Pakistan in your diet. So it should not actually be deficient. And also that it's a fat soluble vitamin, it is basically stored in your liver. So in that way it is quite easy to for you to, you know, supplement your diet with vitamin E. And therefore we have concluded the fat soluble vitamins, and next week we will do the vitamin B complex, and after that we will do vitamin C, which are actually the water soluble vitamins. So take care, and I hope that you enjoyed this video, and if you did, please like, share and subscribe. Take care.